MS215. Let's start talking about how blood moves through the heart. So first I'm going to start off by saying everything you see in blue and purple represents deoxygenated blood. Everything you see in pink and red represents oxygenated blood. So blood enters the heart passively through the superior and inferior vena cava. It enters into the right atrium and passively fills into the right ventricle. So that is the first step of ventricular diastole. Next, you get the atrial kick, where the atrium is going to contract, pushing 30% more blood into that right ventricle, causing that tricuspid valve to close. This is the second part of ventricular diastole. So then next, you get, so the valve closing is the first step of ventricular systole. So then next, the ventricle is going to contract, opening that valve into the pulmonary artery, ejecting blood out of the ventricle into the lungs. So then blood enters into the left atrium, again passively filling the left ventricle, and then you get atrial contraction or the atrial kick, which will fill it past 30%, and then you start ventricular systole when the mitral valve closes and the ventricle contracts and ejects the blood through the aortic valve. So then the blood will travel up the ascending aorta and then down the descending aorta and up the carotids. So let's talk about the electrical components of the heart. So you have the SA node, you have the AV node or the AV junction, because you also have the bundle of His. You have the left and right bundle branches, and you have the Purkinje pathways. So if you have a normal sinus rhythm that starts in the SA node, you're going to be anywhere between 60 to 100 beats per minute normally. If you have a junctional rhythm starting in the AV junction or in the AV node, you'll be 40 to 60 beats per minute. And then if you have a ventricular rhythm, you're going to be starting in the Purkinje or the bundle branches. So, the difference between mechanical and electrical is the mechanical function of the heart is the actual movement of blood, the actual contraction of the heart muscle that will move the blood through the body. And the electrical component is what keeps you in normal sinus rhythm. So the SA node feeds the atriums, and then it'll go from the right atrium to the left atrium via the Bachmann's bundle, and then feed the entire atrium with the internodal tracts. You then reach the AV junction, where there's a pause to allow for the passive filling of the ventricles, which will then continue to send that signal down into the bundle branches and the Purkinje pathways. This will then cause the ventricles to contract and eject the blood out of the ventricles. So then you have the parasympathetic and the sympathetic nervous system. The parasympathetic nervous system slows down the heart rate, and the sympathetic nervous system increases the heart rate. And you can kind of control a heart rate by inhibiting or blocking a certain nervous system, whether it be the parasympathetic or the sympathetic. So if you have someone who has bradycardia, you can block the parasympathetic nervous system, causing the sympathetic nervous system to increase their heart rate, and vice versa. If you have someone that's tachycardia, you can block the sympathetic nervous system and allow the parasympathetic nervous system to take over. Thank you.